everyone and anyone. Welcome to the Veterinary Business Podcast, your ultimate resource for developing a successful veterinary practice and career. I'm Dr. Peter Weinstein, one of the co-hosts of the Veterinary Business Podcast. On this podcast, we bring you insights and expertise from industry-leading doctors, experts, and thought leaders. We cover a wide range of topics, including practice management, marketing, finance, leadership, HR, law, and much more. Whether you're a practicing veterinarian, a practice owner, practice manager, veterinary student studying to be a veterinarian, tech student studying to be a technician, or somebody who just has a passion for the veterinary profession, this podcast is tailored to help you navigate the unique challenges and opportunities in the business of veterinary medicine. Every listener of this podcast is welcome to visit www.veterinarybusinessinstitute.com for additional resources and tools to support your growth. You can also subscribe to our podcast on iTunes, YouTube, Spotify, and any of the other popular podcast platforms. Enough of the formalities. Today, I'm excited because I have Dr. Chris Pachel. Dr. Pachel is a veterinary behaviorist and the vice president of the veterinary behavior at Instinct Dog Behavior and Training. I am hoping he can get me under control, and if not, I am hoping that he can help us have a better understanding of the team-based nature of delivering behavior to our clients and patients. Hello, Dr. Pachel, and I hope I can call you Chris, and welcome to the show.
You absolutely can. Thank you so much for the welcome. It is my pleasure to be here, and I think it might be a lofty goal to get you under control in the next hour or so, but I'll do my best to at the very least shed light on a few things, and we'll see where that takes us.
So, one of the first questions I frequently ask my guests is when did they have their veterinary seizure? When did you decide you wanted to become a veterinarian? I mean, were you playing with dolls? Did you have puppies? Tell me a little bit about what made you want to become a veterinarian.
So being a veterinarian has been my goal, truthfully, as long as I can remember. I don't ever have a recollection of there being another destination. That was it from the beginning. I remember reading, so all of the young adult animal stories, whether that's the James Herriot stories or all of the Black Stallion books or all of that. I was definitely a bibliophile at that point in life and just really thought I want to be immersed in this world. And so I kind of went down that pathway, never really fully considering any alternatives. And I'm grateful that it worked out, but I really have no clue what I would have done had I not actually been successful there. Although I do say that I often got into the veterinary profession because of the animals and because of that desire to immerse myself in their care. I got into the field of veterinary behavior actually more because of my clients. Once I was out in practice and I was hearing the questions and recognizing the pain points that they were bringing in, and recognizing that as a veterinarian, someone who was a relatively new grad at that point in time, I actually didn't know the answers to their questions. And that uncovered a lot of curiosity as well as bordering on embarrassment. And I said, okay, well, I need to do better. And in the process, got bit by the behavior bug and never looked back.
Yeah, I think the behavior bug is like herpes. You can't get rid of it.
Once you see, you cannot unsee what goes on in the brains and the bodies of these creatures that we call our friends and our patients.
So can we give a plug to the veterinary schools and the undergraduate schools that you went to? Because I'm sure they had an influence in some fashion.
Absolutely. They absolutely did. So I did my undergraduate education at Concordia College in Moorhead, Minnesota, background in biology and chemistry and music performance of all things. And then the University of Minnesota is where I did my veterinary degree and where I started my residency in the veterinary behavior field as well. So they had a huge, huge formative influence.
I need to digress because you mentioned music. And there is a correlation between musicians and doing well in the math and sciences. So what was your musical lean going back to Concordia? And should I go get download on Apple Music your records?
So there actually are a bunch, and not as solo artist, but I was a singer, so primarily choral vocal, along with solo voice and piano as performance. So I'm not featured on any of those tracks, but I definitely was a part of a great number of recording sessions throughout our days at Concordia.
So you're the singing veterinarian. Oh, I love it. I love it. We may dive into that later. So you kind of explained why you became a behaviorist, a veterinary shrink, a veterinary psychiatrist. I jest that as an entrepreneur, we are a therapist for our team. We are a therapist for our clients, and we do a much better job with those than we do as being a therapist or a supporter for our patients, because we tend to know how to deal with people. We don't always know how to deal with our four-legged patients. The pandemic brought out the worst in people behavior, and I think it didn't help in animal behavior as well. So let's think back over the last 4 or 5 years. What impact did the pandemic have in terms of behavior caseload?
It's been interesting. I hear a lot of reports from the general practitioners that I work with, that I lecture to, that I take calls from. And it's been interesting. I've had reports anywhere from, we're clicking along, we got busier overall, but overall our case population is relatively the same, to, oh my gosh, we are seeing this entire new population of animals. And subjectively, now this is just my thought, at least based on a couple of conversations, those practices that had a really solid foundation in behavior to begin with, where they were actively coaching clients through socialization and were doing happy visits and were really taking care of that education piece, I think, I don't know, but I think those practices actually fared better in terms of the overall population. And I say that because one of the things that I hear from those practitioners is, when the world changed and we weren't able to go to puppy classes and we weren't able to have the clients in the room with us, and all of those things required a shift, those folks who already understood behavior basically said, pivot, let's go ahead and do it differently. But we're still talking about socialization. We're still emphasizing what it means to be a puppy, developing a worldview that needs to serve them well for a decade or more after that, as opposed to saying the only way to get socialization is by being in puppy classes 1 or 2 nights per week. Right. So the concepts were already there, and they were able to pivot in a way that allowed them to implement. So my suspicion is that, again, it's another example of where that proactive education not only serves us well, but also serves our clients and our patients well, when that is a proactive focus of the work that we're doing in clinic.
Yeah, so we adopted a puppy in March of 2021. So the pandemic had been going on for about a year. And normally I took all my dogs to puppy socialization classes and group classes, and had a really good trainer that we had worked with, who I used to work with in practice. But because of the pandemic, she wasn't doing live classes. So we did
Mhm.
puppy training virtually, which, using a phone and some recordings, was interesting. But I ended up with a dog that would rather be in the house and on the couch, and is very nervous of any noises and going outside. Not aggressively nervous, but just, wants to turn around and head right back home. So I'm speaking from a personal experiences, but I just think some of the lack of socialization, not just on the people side, that's a whole nother discussion. That's not your license. But the lack of socialization on the pet side, do you think that has contributed somewhat to animals ending up back in shelters, and the overfill of shelters we're dealing with right now?
I think it does. And I think it does in a lot of different ways. I mean, you gave one perfect example of that, to be able to say, hey, this is an animal whose worldview was very small. And so now stretching that in any way, shape, or form creates a level of emotional unease up to distress, right? And that's really debilitating for a lot of the animals that we see in our practices. I would say in other cases, when we had people that shifted to a work from home environment, knowing not everybody had that sort of opportunity to do, but for those who did, some of my patients actually fared worse during that phase. The dogs who actually need their midday nap times, who need quiet time in the house, we actually had a fairly significant increase, subjectively at least, in the number of aggressive incidents and anxiety within the home as we were going through all of the stress and transition that was associated with that. And for others, it was like living their best lives, where everybody is there 24/7. And the dogs did amazingly well, and so did the cats for in many cases. And then those animals struggled when we shifted back to the kind of quote unquote normal workflow, and they were now being left home alone again. So it's something that we listen for when we're doing an intake for some of our new patients, to try to figure out not just, did the pandemic affect you, but is there any sort of before or after in terms of that worldview or those conditions under which they were living that now needs to be sort of reintroduced? Or we have to create a bit more of a stimulus gradient or a transition plan to be able to get them into a more integrated society again.
So I'm going to speak as a generalist, because I was in general practice, and I had an interest in behavior. And I went to a lot of courses, and I went to, WVC and VMX, and tried to learn more about it. We had a lot of, being in California, we had a lot of people coming in and speaking to us. But what I also heard in speaking to colleagues is behavior. Too much time. I really don't like it. Give me blood, give me x-rays, give me a stethoscope. I don't really want to get between the dog's ears unless there's an ear infection. So what is it that you tell, because you speak at a lot of conferences, you've got a lot of connections, what is it that you tell young doctors, even experienced doctors, generalists, when it comes to behavior cases, and where their role fits in from a general practice standpoint?
Yeah, I think it's very similar. Now, first of all, I hear that all the time as well from folks either who didn't have the benefit of a comprehensive behavior education to give them that same level of fluency that would allow them to step in, even with those quick Q&As that our clients are likely to punt to us at the end of appointments. But I think that when it comes to the role of the general practitioner, I look at it just the same as we would do anything else. Meaning, when I was in general practice, I wasn't doing TPLOs. I wasn't doing total hips. I wasn't doing, diagnostic allergy testing or any of those things. So there's a level of care in all of these disciplines that exceeds what I'm going to do as a general practitioner. My job as the general practitioner is to understand what's within the purview of my expertise and the time that I have available, and then know where to send them when something goes beyond that. And whether that's something where I can refer them to a trainer or a certified behavior consultant if they need more of an intake or some hands-on practical support, or if there's a medical component that needs to be understood or addressed, or if we're thinking about psychopharmacology as a collaborative intervention for that particular animal, then who's going to do that? If not you, who do you know in your community, or who are your lifelines that you can reach out to, just as if you were referring that orthopedic procedure or those other diagnostic tests, right? So I think about it very, very much the same. Rather than thinking about behavior as an other discipline, to me, it's just another discipline that's just like the other specialties. What do I know? What are my differentials? What's my limit? Where's that line? How do I refer?
Yeah, and as in any case, diabetic, or a cruise ship, or arthritis, or whatever, once you know your limitations, then you can decide. But knowing those limitations can be the hard part. Staying within the lane lines, but we all tend to deviate a little bit. And when it comes to behavior, knowing when it's time to refer, knowing what your limitations are, and then knowing how to refer, because it's different when I'm sending radiographs and a lab profile. You don't want to do harm. So there's that fine line of when is it the best time to refer a case, and where you could talk about behavior, separation, aggression, separation anxiety, litter box, accidents in the house, whatever we want to talk about. But how do we optimize the referral relationship from a generalist talking to a specialist?
I love that question, Peter, because something was recurring to me as you were describing that. If I forgot since veterinary school how to, let's say, interpret a low dose dexamethasone test, right? It's pretty clear. I don't know the answer. If somebody asked me right now, what are your interpretations? What are your reference ranges? I don't know. I can refresh myself, but it's a pretty clear I don't know. So much of behavior feels familiar because we're talking about a lot of shared emotional states, fear, anxiety, and stress, and we're living within relationships, and we all have a touch point there. And so I do think that it often creates a level of, well, I can answer that question. I mean, how hard could this be? And yet, if we don't know the answers, and I'm going to say the current answers, knowing that if we go back to, gosh, even when I graduated 22 years ago from veterinary school, and in the training world, a lot has changed. So the vast majority of explanations, especially when we're talking about dogs, for example, if there's an explanation in your head as a practitioner that's leaning on pack theory or dominance or being alpha as an explanation for why certain techniques work, that's outdated information. It's not wrong in the absolute sense, but it's not right either. And so if you're leaning into those strategies, you deserve an update, and so do your patients. So that may be one little indication. The other one might be, if you were to go to one of the current books, one of the, recently released, the last 3 to 5 years, recently published books, if you were to do some spot checking, hey, what's the current therapy for inappropriate elimination or house soiling? What's the current therapy for separation anxiety? What are the medical differentials for, inappetence? Whatever the case may be, if you do some spot checking and you're like, oh, we know more than we did 20 years ago when I was in practice, then that's probably a good indication that your boundaries around that information should probably be a bit smaller than what you think they are. And that's, one of the things that I find such a struggle for so many practitioners who perhaps didn't get the opportunity to have a 20, 30, 40-hour immersive course in their veterinary school education. They didn't get that comprehensive understanding of this is a puppy, this is a teenager, this is an adult, this is, a geriatric individual. Okay, now let's translate it to cats. Here's a kitten, here's a teenager. And understanding all of that, so many of us, then when we go back to start filling in some of those gaps in our knowledge, we're spot filling based on whichever lectures we happen to grab at one of the major conferences. And that's a great step, but it's not going to give you that same comprehensive picture. And there are going to be gaps in your knowledge. There just are. It's not a fault. It's nobody's, problem to solve necessarily, but we just have to recognize that those limitations they will exist.
You talked about a variety of different things, and when we talk about referral, especially to aborted veterinary behaviorists, we're only talking about a handful of boarded veterinary behaviorists in the entire country. And if you're in an urban setting like myself or yourself, we have choices. If you start to move away from the urban suburban sprawls and into the country, you have fewer choices.
Yes.
And so one of the areas that has become a common discussion in other realms, but is probably even more so, is accessibility. And we've seen a growth in the use of quote unquote telehealth as an adjunct for client patient veterinary conversation. I personally see behavior med as a great tool for telehealth because the environment in the practice is not the environment at the house. Yes. And so can we talk a little bit about business to business telehealth, you consulting with me as a veterinarian, as well as the business to consumer telehealth, and how you handle that both from a client standpoint as well as from a veterinary standpoint?
Absolutely. I love the telehealth conversation. I really do. I'm grateful that I practice in a state, Oregon, that at least early in the pandemic gave us temporary permission to establish VCPR via telehealth. And so we had the ability to do that, not only to create those relationships, but also to maintain them. Again, under those circumstances, it made sense to do. What I love about that is it gave us an opportunity to really experience that in an immersive way, to say, what does telehealth look like from a behavior standpoint? And broadening the scope here for just a second, I've had the great fortune of working in house call based practices, office based practices, both in private practice and in university settings, and then now extensively within the telehealth world. And my belief here, it's a very solid, very passionate belief, is that I don't think any of those are inherently better or worse for the work that I do. You just have to know what you gain and what you give up by going down each of those pathways. So, to your example, if I'm working with a client via telehealth for behavior, I'm able to see that animal in the home environment without my influence in their living room or without the influence of the veterinary practice on the way in which they're showing up within the world. The downside, though, is that compared to when I have that animal with me in the room, and perhaps we both hear a noise elsewhere in the facility, I have a more three-dimensional understanding of those influences and real-time ability to understand exactly what's going on. So doing telehealth, I give up some of that, but I gain other things. And there's a whole list of pros and cons that we could go down if we choose to. But that's kind of the idea for me from a business standpoint of being able to do really, really solid work. As a practitioner, I need to know when there's a limit in front of me that I need to be able to accommodate. Maybe it's with an office visit, maybe it's with additional video, something along those lines. But I'm able to deliver a level of care to a population that otherwise would be underserved, especially when I think about some of the rural communities that you mentioned, or even just those who are distant from a veterinary behaviorist. I'm here in Oregon and we have 4 board certified veterinary behaviorists in and around the Portland metro. And yet there are none in Washington state,
Hmm.
as an example. Like the moment you get across the border, technically one of the Portland diplomats lives across the border, but in terms of actual serving the population, none in Seattle, none in Idaho, none in Montana, none in Utah, none in Nevada. We have all of these states where we really don't have care. So if you happen to live in one of those behavior deserts, if you will, what does it look like to get access? And for me, telehealth is one of the ways that we have the ability to do that.
So in those situations, let's just pick Washington State. If you had a patient in Washington State that you did a telehealth visit with, you really cannot prescribe. If you got down to a pharmaceutical approach, you can't prescribe anything to help them from that standpoint. But there's nothing, correct me if I'm wrong, that precludes you from making suggestions as to homework of things that they can do in their house. So it somewhat solves the problem and it gives access, but it doesn't necessarily solve all the problems if you are in a pharmaceutically based case.
Exactly. And one of the ways that we work with those limitations here at the practice with the Animal Behavior Clinic here in Portland is we can do an initial intake with that client to basically say, tell me about your world, tell me about the struggles, what are you hoping to gain, what are we doing here? We can give some homework from a training and management standpoint. We can also take that information and say, cool, now I'm going to have a chat with your primary care veterinarian. I'm going to relay some of what I've learned and provide them with a bit of a framework within which they can make some recommendations. They can work with you as the veterinarian who has that client-patient veterinary relationship, and they can then choose whether or not to prescribe or recommend additional diagnostics. But they're getting access to my brain or the brains of my colleagues as an in-between, essentially, to gather that information versus trying to onboard all of that skill and knowledge to the brain of the general practitioner who may not have the time or the interest or the bandwidth to do so.
So it becomes a B to B to C, basically you with the veterinarian and the client in a collaborative fashion. I love the concept of collaborative healthcare. It's what the Mayo Clinic essentially does. And I think that the more that we can work in a collaborative fashion within our practices, as well as between our practices, the better patient care is. That's my little soapbox, sorry.
I'm with you on it. So yeah, I'll put you right back up on that soapbox if you try to get off. So I completely agree.
Well, it now allows us to kind of jump a little bit into the soapbox that it talk about team-based healthcare delivery. To me, these types of cases that you deal with will require a veterinarian, but they could also require a credentialed technician or a veterinary assistant or even client service people, because a lot of it is listening and a lot of it is data collection. And what are your thoughts about the importance of behavior-based practices, or those practices in general who are doing some behavior, making it a team-based effort and not just a doctor-centric effort?
I love that. And I think there's so many reasons to have a team-based approach, not only in the behavior world, but really across everything we do, right? I often think about that as you know, if a client were to call a veterinary clinic and they call, hang up, call again, hang up, call again, and if they end up talking with three different people and they ask the same question, if they get three different answers, and of course they're not going to be scripted, right? I'm not saying we're getting a verbatim scripted answer, but if they get three completely different responses, that's not helpful. And we're now putting the client in the position of trying to decide, number one, can I trust the clinic if they're not sure of their protocols? Can I trust that everything is going to be handled appropriately? You know, or if we're trying to go down that pathway of really figuring out what happens next, I don't want the client to be guessing ultimately, or having to say, well, it's Tuesday, so Dr. So-and-so's on, but at Thursdays, I'm going to talk to Mary at the front desk, but on Fridays, I get Steven, and so that's going to change things. It's just not a comfortable, predictable, safe way for clients to experience veterinary care. And for me, that goes, you know, again, behavior and essentially everything else that we do. So that requires that we have a team-based approach so that the client services folks are answering questions that are within their purview, that will then be a cohesive response to the assistants, to the technicians, to the doctor, versus having more of a, you know, a scattered response pattern.
You know, it's interesting, and this has nothing to do with anything probably, but we're very good at educating silos. We've got medical education, we've got technician education, we've got a limited amount of client service education, but really there are very few workshops where the doctor, the technician, the client service person, the entire team is there. And I think because trying to do that live means essentially closing the practice.
Yeah.
But especially in behavior, it does seem like it could very easily be modular online education that the entire team could be a part of, so that everybody is singing the same music. Because, you know, as a singer, I knew I would get back to it, that if you all have a different sheet of song music, it's cacophony, and you really want to make music.
Yeah, I absolutely agree with that. You know, I will say that one of the things that I really appreciate, you know, about, as an example, the fear-free education and all of the movement that has happened there. I think they were one of the, in my opinion, one of the pioneers, one of the folks on the forefront of doing exactly that, of saying, especially from the behavior aspect, when we're talking about fear and anxiety and stress and all of those influences on veterinary care, what's the role of client services? What's the role of the technician? What's the role of the doctor? How do we work cohesively within those modules, within level 2 and level 3 of that certification? And it was something that when I worked through those levels, it was sort of that same moment that you just described. I'm accustomed to educating silos versus saying, here's your point of intersection. Here's where there's a passing of the baton. Here's where we have to be cohesive while still having different areas and different points of intervention. We have to be working as a team. And I will say, I hear that a lot from technicians, especially who are coming up after a lecture and they're saying, I'm with you. I'm completely on board for everything you just described about low stress handling or pre-visit pharmaceuticals or whatever it happens to be. How do I get my doctor on board? Or how do I get the receptionists and the client services team on board? And we've got to be able educating across those lines so we truly are operating as a cohesive culture within the practice and within the industry.
If it makes you feel any better, Chris, when I get done talking about practice management, I have managers come up to me and say, how do I get my doctor on board? So it seems like the unicorn is the veterinarian in many ways.
Well, it's true. Like I you know the business side, infinitely better than I do. From my perspective, though, the veterinarians are often the practice owners. They're often the ones who are either leading the charge or dragging the anchor, right? In terms of figuring out what are we doing. They're either blazing forward or, and I get it, right? We're busy. We all have so many things competing for our attention. And the idea of doing something new or different is inherently scary and it's inefficient and we don't know how it's going to go. And so there's all of these reasons to kind of keep doing it the way we've always done it. And yet, how we've always done it isn't always the best way forward. And finding those opportunities where we can take one or two strategies and say, well, let's just try that on for size. Let's do that for 2 weeks and then regroup. We're not completely turning the practice on its head, but what would it look like to approximate some of those bigger movements? And that's one of the cool things about working in the field of behavior. The same thing that I'm talking about here with taking those little approximations is exactly what we do for the dogs and the cats and the horses and the birds and the people that we're working with. What's a doable next step toward that big picture goal that we're trying to accomplish? What does it look like to understand it, to really identify the action items, and then to regroup to ask the question, did it help? If not, cool, then let's do it differently the next time around, but let's try.
It would be fun for you and I to do a collaborative talk on behavior training patients and people and staff,
Okay.
because in many cases, we treat staff like puppies and we discipline them weeks after they had the accident in the house, thinking that that'll help them learn. So we could go on a sidebar with this, but I won't right now. But you know where I'm going.
I absolutely do. And I have to say just one little thing on that. I promise I won't derail us. I go even one step farther with that to say, even if we're talking about delayed consequences, on the behavior world, we spend so much time with what we call antecedent arrangement. Did we actually set the environment up for the animal, human or otherwise, to be successful? If we didn't do that, I almost don't care what the consequences are. If the environment is not conducive to success, people or other animals are going to continue practicing doing it wrong. They just are. That is animal nature. So there are so many parallels that we could spend hours teasing out, and I look forward to that opportunity, Peter.
Oh, I'm just starting. I'm writing a chapter for a book on training or lack of training and the failure to invest in training. And it's, we don't do it in our practice, but we encourage our clients to do it with their pets. It's like we're talking out of both sides of our mouth from that standpoint. You mentioned fear-free. I just, what's your 35,000-foot overview on fear-free?
Yeah, I think it's really moved the practice and the practice of veterinary medicine forward. I can't talk about fear-free without also giving a nod to Dr. Sophia Yin and everything that she did from a low stress handling movement and really truly kind of taking us all by the collar and saying, look, we can do it better. We can do this. And so I love that we had a foundation for that. I think the fear-free movement has really taken that next step forward. I also know that there's some new information coming out from the work of Dr. Yin. It's been sort of picked up again. There's a new version of her low stress handling book that's coming out soon-ish. We're in spring of 24, so coming out soon. So I love all of those things, right? I love looking at them from the standpoint of what does it look like to reduce animal anxiety, distress? What does it look like to preemptively prepare them for stressful experiences in the clinic? What does it look like to educate our teams on body language and client communication, especially around some of these protocols? What does it look like to actually incorporate that behavior into the daily practice of veterinary medicine, even for those practices who don't, quote unquote, see behavior cases? Yes, you do. Every single practice that treats any animal of any species in any capacity sees behavior cases. You just get to choose, are we doing it more at the triage level? Are we maybe not even doing that, but we're understanding what it is that we're seeing and how to refer? Or are we actually moving them forward with consultations and or referral to specialists? All of these are options, but we cannot say we don't do behavior, because you do. You just do.
Yeah, we just don't ask.
Totally.
Don't ask, don't tell, right?
Yeah.
So consumers, pet owners, and veterinary practices deal with a lot of confusion from what I would call alphabet soup. We have behaviorists, veterinary. We have trainers, non-veterinary. We have others who have so-called credentials on the internet who want to play Dr. Phil or Dr. Freud. Can you help us understand the alphabet soup with respect to the initials that are out there, and where they fit in terms of a practice setting, and who do we go to first, and who should be in our toolbox, et cetera?
Absolutely. So, certainly we've got the DVMs or the VMDs out there, right? So we've got our veterinarians and then our specialists, typically the DACV, in my case, B, so Diplomate of the American College of Veterinary Behaviorists, as opposed to surgeons or internists or internal medicine, all of those sorts of things. So we have those. The reason I start there is that if we're talking about diagnosing and prescribing, those are the letters. End of story, full stop, period, next paragraph. We have that is the limit of what we're doing there in terms of those things. Now, I'm not saying that those individuals only do the diagnosing and prescribing, but if we're looking for that information, you want to be turning to one of those individuals to provide you the education and the information you're looking for. From there, we've got a whole host of incredibly skilled individuals. So as I say this to me is not a pyramid where DVMs are at the top necessarily. It's more like a multi-lane highway. What's within my lane to do or not do? And then if we're talking about trainers or behavior consultants or applied animal behaviorists, these are all credentials that have education, exams, ongoing certification required, continuing education, all of those sorts of things in order to be able to maintain those certifications. Where it gets tricky is there are so many letters, as you say, and whether we're talking about independent organizations like, for example, the International Association of Animal Behavior Consultants, or IAABC, they provide a lot of education, but they're not an educator for certification, meaning unlike some of the other specialty training, like there are certain separation anxiety trainers, for example, or trainers in other methods that have been popularized by an individual trainer or behavior consultant, where you can say, I have certified you in my method. I really like looking at some of those independent bodies to say, you need all the information, come back to us when you have it, and we'll tell you whether or not you hit the bar on that metric. So I love those organizations probably a notch above. It doesn't mean those other organizations don't have an amazing skill set, but it's something different when you are basically saying, here is the education, and now I'm going to certify you in it. It creates a slightly different process. What I also try to be clear about is that when I look for certifications and I'm looking at what each of those letters really mean, it's not saying that everybody who has those certifications is inherently equal in terms of their skill set or their knowledge or experience, or that someone who's not certified doesn't have a lot of information or value within the industry. But there's a certain benchmark to be able to say, you have done the work, you've put in the hours, you've passed the exam, you now have that standard with those letters behind your name. So I could probably spend 3 hours truthfully going through all of the different letters in the industry. And for those of you who know the behavior world, you know that I'm actually not exaggerating when I say that. We could look at all of those things. What I typically tell the consumer is, don't get blinded by the letters. Don't be like, ooh, lots of letters, that means amazing things. it's really possible to accumulate a lot of letters without necessarily doing a lot of work. So make sure you know what the letters actually mean, looking for some of those guidelines that I was just mentioning, whether it's an independent certifying body, for example, or something different, and really asking those questions of the practitioner to make sure you're getting the information from a reliable source.
So sometimes you need Vanna White and Pat Sajak, is what you're saying, if you like to buy a vowel.
Yes, very much so.
I want to kind of, good medicine is good for business. So I want to talk about a little bit more on the clinical side, because I do think by understanding where veterinarians' role is in behavior, we can do a better job. And as a retired, hardly, veterinarian, I tell many friends and colleagues that are outside the field that there are no bad dogs, just bad dog owners. And of course, that's not completely correct. But where do you think, I mean, we've got all of these breeds now, and we've got the purebred Labradoodles, quote unquote. Where do most behavior issues come from that end up on your Zoom or phone or office?
Yeah, I would say the vast majority of the cases that we see, at least in the behavior clinic or through the training company that I'm a co-owner of, it's typically animals with big feelings and insufficient coping skills. If I were to boil it all down into sort of one tagline, big feelings, insufficient coping skills. These are animals that are having very strong emotional reactions, and they don't have productive or safe ways to dissipate that arousal or to behave or shift their emotional state into a way that's actually conducive to them actually working in the environment in which they live. And that's a really important way to think about it, at least from my perspective, because when we talk about that as big feelings, insufficient coping skills, there's a natural sort of segue then into saying, is there anything that would, let's say, make that more challenging for dogs? And that gets us as veterinarians down to pain or endocrine related disorders. And we're talking about, especially if we're talking about things like Cushing's or Addison's disease that directly affect the hypothalamic pituitary adrenal axis, which is what regulates big feelings. Right. The inroad there for veterinarians, even if you're not quote unquote seeing or doing behavior, is to understand the influence of all of these other things to say, hey, what influence would pain have? What would itch have in terms of an influence on my patient? If we have a new baby in the home and nobody's sleeping well, what does sleep deprivation show up like in terms of mental confusion or irritability? And how might that manifest as aggression or anxiety or house soiling issues or any of these things? That's the place where we can use our veterinary brains in all of the ways that we were taught to do, to then say, what might this look like, versus saying behavior change equals behavior and I don't do behavior. You may not do behavior, but gosh darn, you know how to do medicine. So do medicine, just understand the behavior piece. So all of that for me is a way to think about the patient population that comes through my doors, those big feelings without coping skills. If we are ensuring that that animal truly is physically healthy to the best of our ability, then we can go down the pathway of pursuing it from a behavior perspective. Let's look at the environment. Let's understand how to leverage positive reinforcement. Let's look at differential reinforcement and so on. Then we can get into all the protocols and all of those things that we can go into. But it's really understanding that basic influence on behavior that makes such an important difference from the veterinary world.
I'm not sure if what I'm about to say is going to get edited out or not, but when I hear big feelings without coping skills, I think politicians. But
these are universal problems, right? Big feelings, poor coping skills. It invariably, well, maybe there's some variability within there, but it's generally a pretty common recipe for, well, inappropriate outcomes.
Top 3 to 5 most common behavior cases you see.
Separation anxiety or separation related problems, certainly at the top of the list. I would say these days, generalized anxiety or an inability to adapt to changes in your environment is another one. Pain-related aggression, I would say, is at the top of the list these days, especially as we look at some of the GI pain or discomfort, orthopedic, musculoskeletal issues. We see that manifesting as aggression. Elimination disorders, especially when we're talking about cats, and all of the reasons why they may choose to eliminate elsewhere. And then I think probably the last one, and it's going to be a little bit of a catch-all, but I'm going to say misunderstandings. People that just, are doing the best they can with the tools they have, but don't understand the animal they're living with. And once we shed some light on what's actually going on, they say, oh my gosh, now it all makes sense and I know exactly what to do, but I never would have gotten there on my own. So it's not really a diagnosis or a pattern, but it's a very consistent theme that we see both in the training world as well as in the veterinary behavior practice.
So by the time you get to see some of these cases, they've been through the ringer, and you're being asked to, well, in many cases, is a last ditch. So what's the most frustrating behavior cases that you deal with?
It's interesting. I would say some of the ones that are more frustrating are those that have a medical component that we can't just snap our fingers and make better. For example, we see a lot of non-specific gastrointestinal upset in our patient population. The animal that vomits or has loose stools, not every day, but more often than they should. And without going down the pathway, or until we go down the pathway of additional diagnostics, to some degree, we're flying blind because I can't really see inside the gut the way that I would like to do if I was, let's say, dealing with a skin disorder. I can't just easily take a little biopsy. I'm oversimplifying the derm world, of course, here for that example. But I think those medical issues that don't have an easy solution, those are the cases that often require a much more significant investment from our clients. And the treatment course is often, not always, but often more prolonged. And there's going to be more sort of stops and starts where we make some progress and we may have a backslide because some of these medical issues are chronic. And it's not just a matter of waving our magic wand, prescribing the right antibiotic, and we move on. So I would say that would be one side of it. The other one, on the behavior side of things, I would say if I go back to the early days of my residency and the case population that I saw, I worked with a lot of naive dogs and cats where they hadn't really had a lot of exposure to training or behavior modification. And now what I see in my practice, for better and for worse, is that so many of our clients are trying. They're looking online, they're working with trainers, they're working with their veterinarians. And so the fortunate thing is that we're helping a lot more dogs so they don't need someone like myself. But also, if somebody has tried 4 or 5 or 19 different strategies, oftentimes by the time the dogs or cats come into the office, they're actually pretty confused and often very skeptical. And so we have to work that much harder to be able to create a framework around which to give them that structure and predictability and sense of safety that allows us to actually address the underlying issues.
I got like 43 questions I want to ask you, but you just went off on an interesting tangent that I want to follow up on. So in many cases, we as veterinarians deal with pet owners who have gone on the internet and done some due diligence or misdiligence or disinformation or misinformation by the so-called online experts and so-called breeder experts. And we are being challenged by our pet owners with information that they have gathered that really doesn't have a veterinary basis to it. And to be honest, being confrontational isn't going to do us any good. Do you have any suggestions as how our colleagues can help pet owners who come in with 83 pages printed out in 6-point font about information that makes no sense?
Yeah, we see it in the behavior world as well. And the first thing that I tend to do when I have a client who's approaching me in that way is I usually start out with some version of gratitude and sort of acknowledging the hard work that they're putting in. It is clear that you are putting a lot of effort and a lot of time and a lot of diligence, do or not, a lot of effort into gathering information. And that's awesome. I can tell that you are trying to do the best you can and you're gathering all this information. So amazing. Love that for you. I love that for your pet. And there are different levels of sort of reliability of that information. I don't want you to go out into the world and amass a huge pile of garbage, right? That doesn't have value to it. That's not going to be helpful. So what I then often respond with those clients is either saying, how can I be of help? Either I can give you my opinion based on the information we have available, or I can give you a bit of a framework about how to be a more critical thinker as you're gathering that information, whether it's looking for credentials, whether it's fact checking it against some of the known data banks that we have to be able to look at veterinary or animal care information, something along those lines. But ultimately, I'm going to ask the client, how can I be of help? What does that look like for you? And if the client says, I'm going to need you to read this 83-page 6-point font and highlight it and give me your 97-page thesis on what's right and what's wrong, I'm not going to be able to provide that help for you. So then it gives me a very clear opportunity to set that boundary to say, that's not something that I have the capacity or the time or, quite honestly, the interest in doing. If, on the other hand, you have specific questions and I have the ability to answer those questions or provide you with my feedback, amazing, let's do it. I can see you Tuesday at 3, I bill at X dollars per hour, and I look forward to answering your questions then. Something along those lines that sort of tries to make sure that, as best we can, that the client feels heard and seen in the process. And I'm not trying to do something that's actually not in my capacity to do. That's going to create frustration for me. And if I try to do it halfway, I'm actually not going to meet the client's needs and they're going to be frustrated too. So how can I do that in a way that really identifies the ask, allows me to say yes or no, and that goes in both directions, whether it's client to veterinarian or veterinarian to client. And if we're a good fit for that process, then we move forward. If, on the other hand, as one of my colleagues, Dr. Susan Friedman, says in examples like this, if the client has a need and I don't have their reinforcer, or I have a need and the client doesn't have my reinforcer, we're actually not a good fit for one another. And I'd rather recognize that sooner or later, not saying that they shouldn't be helped or that I'm not able to be of help, but we're just not a good fit. And I'd rather get them into the hands of somebody else who can help them.
Couple of quick, well, none of these are going to be quick questions, but how useful is pet insurance when it comes to some of these behavior cases?
Yeah, pet insurance is sort of it's a big question, right? I would say variably helpful, depending on the company, depending on what they do or don't cover, depending on what they consider to be a pre-existing condition, especially when we're talking about this big umbrella, where if the majority of what I see is big feelings without coping skills, then sometimes they would say, oh, we identified a nervous dog at 9 weeks of age for their veterinary exam, pre-existing condition of fear. No, of course they did. Fear is a normal emotion that should be present in every single animal. So I think we've got a lot of education and opportunity to really figure out how we do that. When it works, I love that insurance coverage sort of removes some of the limitations and allows us to really do the diagnostic testing, to pursue the treatment options, to work through behavior modification protocols. And I love when we get the opportunity to do that. It's not always a smooth process.
You mentioned education. Let's talk about education. What's your take on the responsibility of veterinary schools to include behavior, sufficient behavior, not just companion animal, because equine has some behavior issues as well. What's your take on the responsibility of veterinary schools to include more behavior education in their curriculum?
Yeah, I think honestly, I'm biased, of course, as a veterinary behaviorist, but if I were on the curriculum committee, it would be appalling for me to send out a new graduate without having a solid foundation or the opportunity to have had behavior education. Because of how integrated behavior is in our assessment of health and disease, even if we're not teaching them, quote unquote, how to do a behavior consult, to not have that fundamental understanding that horses get ulcers, just as one example, if we're talking about the GI tract of horses and what are some of the effects of not providing the opportunity for animals, captive animals, to engage in species typical behavior patterns, and what are the consequences in terms of chronic stress and activation of all of those pathways. If our veterinarians don't understand that at a basic level, they will not be as effective as veterinarians. So I think it's appalling to not have that included. And I also understand that a lot of the standards for veterinary education are created by folks who themselves didn't have the opportunity to have a behavior education. So I have to really, extend some grace to them as well and say, I know that you don't know that lens that I have. I would love for you to learn more so you can understand how important this is by asking your graduating veterinarians. When we do those surveys of what do you need to know, behavior is consistently at or near the top of those lists. Our graduates need it. Full stop, end of story. Anything less than that is doing them a disservice.
As long as you don't take away my practice management hours. So
Oh, I trust me, I will not take that away. It's one of my greatest limitations. We had a little bit of education when I was in vet school. As you were, you and I were chatting on the pre-call a little bit too. That is one of the greatest areas of weakness still for me, and it's an area where I'm piecing it together in a way that I'm 22 years in and I'm still trying to figure it out. So thank you for doing what you do on that front.
So you mentioned, we talked about companion animals and equine and behavior issues, but you have a story to tell or two about your iguana's behavior issues. So I wasn't going to let that go.
So I love the fact that that Aniko makes their way into this story as well. I had an iguana that I acquired when I was a pre-vet student, right before I came into veterinary school, and I had Aniko for a couple of years. I eventually rehomed her because I wasn't a good fit for her in terms of my veterinary schedule and all of those things. But she taught me a few things about how to communicate with animals that are not dogs and cats. And so working out, even at that point, a consent-based interaction with her. For example, if she was out and loose in my apartment, which she frequently was, if she were typically resting on the handlebars of my bike, which was perched in front of my window, if she was sunning herself, and if I went up to need to pick her up to put her back, if I just swooped in and grabbed her, she was likely to tail flick or bite. On the other hand, if I moved closer, made myself available, and created a stable platform for her to step onto, if she made even a small intentional movement in my direction, that was my invitation to then gently scoop her up and move her. So it was the understanding of that conversation about how to recognize what the animal is telling you rather than just saying, oh, she was mean, she was a bleep. No. And so it was a really good indication for me, even in that capacity, to learn about some of those communication options.
So is it true you can't teach an old dog new tricks?
Not even a little bit. No, we absolutely can. We do it all the time. Now, there are differences in learning capacity, and certainly the longer an animal has been practicing a particular behavior pattern, perhaps the more repetition they're going to need with different reinforcers or different consequences in order to learn new patterns. But we work with geriatric or advanced age pets all the time. And truthfully, I love that I have that perspective, because if I were to say, no, they're pushing the second half of their life, there's nothing more we can do. Gosh, I'm going on 49. I'll turn 49 later this month. If somebody were to tell me I'm in the second year of my life and there's no possible way that I could learn anything new or change my behavior patterns, that would be a bit of a buzzkill. So no, absolutely. There's never, in my opinion, a scenario where we can't intervene in a meaningful way for whatever comes next.
And we didn't talk a lot about cats. And cats are not the poor stepchild of dogs. And they do come with their own idiosyncrasies, for lack of a better way to put it. Talk a little bit about cats and behavior issues. We have elimination behavior issues. We've got the natural clawing issues, all of which can be disconcerting to a pet owner. and could be reflective of different or no issues. So can you just talk a little bit to the listeners about, the importance of considering cat behavior as part of the conversation as well?
100%. Yeah, I'm glad you brought that back, Peter, because it's something when you understand cats, and I know some people even think about that statement as a bit of an oxymoron. Wait a minute, understanding cats, aren't they little alien creatures that live in our homes? No, they have actually some really, really typical behavior patterns that once we understand them, a lot more of those problem or nuisance behaviors and some of their behavioral diagnoses make a lot more sense. Some things to understand about cats are even the things like that, well, they are predators, but they're also prey species. So they're going to behave as both, meaning their environment is really important for them, that they have outlets for predatory behaviors, play, chase, food enrichment, those sorts of things. And they would typically go through a predatory or hunting sequence 20, 30, or 40 times per day, which gets us back to some of the pillars of enrichment for cats, that if we're not providing them with those opportunities to engage in normal, typical, species-specific behaviors, it's likely that that need is going to show up in other ways, whether that's a stress response or whether it's aggressive behavior or any other number of patterns. So look at what their needs are. Are we doing a good job to provide for them? The other thing that I think is really important to understand is when I start talking about cat training, for example, training of cats, oftentimes people say, wait a minute, I didn't think cats could ever be trained. That couldn't be farther from the truth. They are absolutely brilliantly intelligent creatures. However, even just for a second, switching back over to dogs, if we look at some of the breed specific patterns, those breeds that were intentionally bred for partnership relationships, also oftentimes thinking about our hunting or our herding breed dogs, but even in the hunting breed dogs, if we're talking about hounds who were bred to basically come out of the back of a truck and go off and do their thing screaming through the woods, those animals are not genetically predisposed to looking to us for feedback or understanding how do I work collaboratively with you. Cats are very much the same way. They don't necessarily come out of the womb thinking, I need to know what my human needs from me and how we partner together and how we collaborate. They're operating under their own agenda much of the time, which does not mean that they're not influenceable and trainable. We just have to understand that they're not going to automatically be looking to us for approval or feedback. And we have to understand how to set up the environment and some of the reinforcers to be able to shape the behaviors that we're looking for. Once we do that, oh my gosh, it's amazing.
Well, over the last hour, you have proven something, that you can teach an old vet new tricks. So thank you, being the old vet in this conversation. Great content and information. Chris, how can our listeners find you? I know you've got some speaking engagements scheduled between now and the end of the year. Feel free to share some of that, or your website or your business. I think it's important that resources like yourself become available, because they're not always accessible. And I appreciate your making yourself accessible to me and to our listeners, and hopefully making yourself even more accessible. So how can people find you?
Yeah, the easiest place to find more information from me is on my website, which is drpachel.com, drpachel.com, very, very creatively named. From there, the main homepage will allow you to link to any of the projects that I'm involved with, whether that's my work through instinct dog training, whether it's my speaking schedule, whether it's a list of podcasts and webinars on the media page from there. Everything gets curated there as I get the opportunity to get that updated. People can also track me down on social media as well, primarily through the Practice Animal Behavior Clinic. We've got a social media presence on both Facebook and Instagram. And yeah, I would say I've got a couple of conferences. I'll be teaching at Fetch Atlantic City or Fetch Coastal. I'm also scheduled to teach at Fetch Long Beach, and I've got a bunch of other courses and webinars on the schedule as well for the rest of the year.
Well, I look forward to buying you a bottle of water at Atlantic City or Long Beach. And when they asked me for a title for the podcast, and I said, behave yourself, behavior counseling in your veterinary practice. And that's what this was. And so, Dr. Christopher Pachel, thank you for joining us today and for talking to us and sharing your wisdom and your humor and helping maybe guide the current generation and the next generation of veterinarians so that the longevity of our patients isn't determined by behavior, but based upon our ability to be good doctors. And I think, as you know, we lose more patients to behavior problems back into shelters, et cetera, than we do to other things. So thank you so much for your insights that hopefully will keep our pets and our people together.
Thank you for the opportunity.
We appreciate you, Chris, and I want to take a moment to thank our listeners. We appreciate each and every one of you. We cannot do this without you. If you like our podcast, kindly share it with your colleagues and friends on social media. Also, please don't forget to leave us a review on your favorite podcast platform, Spotify, Apple, et cetera, et cetera. Your reviews will help other doctors and practice owners and managers and veterinarians and students find us. Until next time, keep striving for excellence and making a positive impact in the lives of your patients and pet parents. I wish you all an amazing week ahead.